Hi again. We get a lot of questions from people that visit my website. So I've asked Barbara here who's part of my team, to join me and kick off the session. So what is the first question, Barbara?
Okay, Jean is asking, is it possible and safe to have Botox while breastfeeding, or should I wait?
Well, Jean, that's a good question. And the rules on Botox with breastfeeding are that you shouldn't give it. It's not that it's not safe, because we have plenty of anecdotal stories where people, have used Botox whilst they've been breastfeeding, and it's not caused any problems. Having said that, it's not to be used as a prescription medicine for those that are breastfeeding.
Okay, good advice. Jean wants to know, I'm 32 and getting married in 5 months and would like to know the best time to get Botox and or fillers in advance of my wedding.
Well, congratulations, Jean, on your wedding. I usually find with most of my patients that the best time to have Botox prior to any wedding or red carpet event is about 6 weeks. And the reason is that the Botox looks its best at 6 weeks. It's broken in, it looks very natural, and that to me is about the best time. I think with any procedure prior to any event, you want to allow a good bit of time just in case you get any bruising. So when we come to the fillers, they are more prone to give rise to bruising. So again, I think, at least 2 or 3 weeks for those prior to any event.
Oh, that's good advice. Olivia is asking, the lines on the side of my mouth make me look angry. What treatment should I have to fix this? I have to say, we get a lot of questions like this. I just happened to pick Olivia's, but there are a lot of questions on the website regarding how to fix this.
Yeah, and actually, I get a lot of requests to treat these lines. They're called marionette lines. And usually it's a combination approach for these. Typically, we use Botox if we can, and the muscle is there to do so, to give lift on the corner of the mouth. But in the majority of cases, we are using a combination of fillers in the mid face to lift, and we're using some very soft fillers with a different technique to prevent muscles pulling down uh, the skin and the tissues. At the same time, we're also using very soft fillers or skin boosters to treat some of the crepiness and the wrinkles around the mouth as well.
Oh, good.
Yeah.
Okay. Keith wants to know, I'm 35 years old and looking for advice on what I can do to lift my jowls. Would filler be the best option? I have to say that a lot of guys are emailing us asking about the chin and the jowls.
Yes, and we do get a lot of questions about that. I think, particularly now, and I think with Zoom consultations and virtual consultations, uh, we're more conscious of our face, and it seems to be what we call the lower third uh, that we notice more. And I think with the men, obviously having a strong jawline and chin is very important. So if you are starting to develop jowls, typically in this area here, it tells me that you are starting to lose tissue. It's starting to sag really from the mid face. So when we're treating jowls, typically we're sort of using a combination approach where we're lifting the tissues, but we're also supporting the jaw, typically at the angle here, and the chin to give this to sort of improve this contour. But if the jowls are very serious, we'll also be using fillers pre and post jowl to enhance that contour and improve that definition.
Well, we get so many questions on that. John is asking, I have deep smile lines. Do you think filler will help or something else?
So, John, yes, deep smile lines. So I'm guessing you're referring to these here. Um, the danger there is it's tempting to put filler into these lines. And I think many years ago that was probably the way that we did treat those lines. The problem, of course, is that if you do that and you are certainly using the wrong type of filler, you'll end up looking like a chipmunk. So if we are treating these lines just directly, then we're going to use again some very fine fillers. And typically there are different techniques, but we're going to look to provide structural support underneath these lines, usually perpendicular to the line. We may use a skin booster as well to soften the effect of those lines. And in particular cases, 35 doesn't sound that old where we would consider doing this. But again, if we're needing to lift, and these lines are caused by sagging tissues, then we're going to use some much more supportive fillers up in the mid-face.
Um, that's it. No more questions.
That's it for today?
Yep.
Okay, well, if you have more questions and you'd like to sign up to my newsletter, please do so. At www.drsib.com. Thank you.